Okay, everyone. James, focus. Okay, we're in school today, and today's topic is, what are we talking about?
Coronavirus.
Coronavirus. We're going to learn about coronavirus, okay? So, first things first is the name coronavirus. What do we know about that? The virus is not called coronavirus. It's actually called SARS-CoV-2. SARS means severe acute respiratory syndrome, and CoV was the original outbreak of this disease in 2002. Got it?
Yeah.
Got it. And then now it's the new one, so now instead of CoV, it's CoV2. Okay? And they call it COVID-19. That's the disease, not the virus. The disease is called COVID-19. What does that stand for? Coronavirus disease 19, which is the year it was found, 2019. So coronavirus disease 19, COVID 19. That's what. That's how that works. Okay. So the history. When did we find out about coronavirus? In December, December 2019. Right. There was a new strain of pneumonia. We talked about pneumonia in Wuhan, China, with an unknown cause. All right. This is a new virus. Are we paying attention? Hey, it's going to get good here, but focus. There's a new virus strain, so we've never seen it before. So our bodies have never had this before. So when it gets inside of our system, we don't know what to do. That's why we get so sick, right? So what do we say about the statistics? How many people are going to get it? So 80% of your school, let's just say, how about this? In all your school, 80% are going to get sick from it. Okay? Of the infected people are going to get sick. So if you get sick, 80% are going to have mild symptoms. Knock it off. And mild symptoms means what? We're not going to have to go to the hospital, right? We're going to stay home in our beds. We're going to relax, and we're going to get better. But 20% are going to have to go to the hospital, and that's not good, right? So 20%, let's just say, is your one classroom. So if your whole school, your classroom is going to have to go to the hospital, right? Because there's about 25 people in there, right? Let's just
23.
say 23. Okay. And half of your people in your classroom are going to have to go to the ICU, which is like where Daddy was when he was having his surgery on like the 6th floor, right where the sick people are. Okay, so only half of your classroom. Okay, and out of half of those people in your classroom, 5 of them are going to need vents, which means just the people at your table are going to need vents, which means that's the breathing machine, so they can help breathe. They're in really bad shape if you need a vent, right? And out of the people at your little table, the 5 people that you sit with, about 2 or 3 of them are going to get sick and they're going to die, right? So that's kind of how that works, right? All right, so how does the disease spread, right? How does it spread? How do we spread coronavirus?
By people going by each other.
Right, if you're getting closer to it, right? Because if you cough or you sneeze, right, it's a droplet. So if you sneeze and you cough, a little bit of spit comes out of your mouth, and there's a little germ, a little bug in there, and it gets in the air, and what does it do?
It crawls all over
And it gets
us.
right inside your nose, and you suck it in, right? So that's why it's called by droplets, right? Saliva and mucus with the virus, right? So it's got to have a little bit of water. It's not airborne like people are saying. It's not floating around in space like pollen, like allergy dust, right? So it does not. It needs a host. It needs water to be able to be transmitted. All right, then what is it going to do? It's going to go and you're going to inhale it, right? Because it's a respiratory disease. It's SARS, severe acute respiratory. So you got to sniff it in your nose or suck it in your mouth, right? And it's going to go in. And where does it go? Look, here's your picture. Where does it go? In your mouth and in your nose, all the way down the trachea and into the
Lungs.
lungs. Good. These are the lungs, right? So this is our little picture that we drew. So it goes in the lungs. All right, and then it starts to work. It's magic down there, and that's where it starts to do really bad stuff. So what happens if you just inhale it, but it doesn't get sucked all the way down, and it sits right here in your nose? It's called an upper respiratory infection. And let's see what it would look like on James. So you suck it in, but you don't take a big breath where it goes all the way down into your lungs. It doesn't go here. It just stays right here. And then upper respiratory, you might get stuffy nose, sinusy where your eyes are red and watery. You go all snotty, drooly, maybe a headache from your sinuses, maybe your ears will start to hurt because the infection is harboring, right? And it's breeding and it's growing all inside your head. And you almost get cold-like symptoms when it's up there. Cold-like symptoms. So 80% of these people are just gonna have flu with a fever and some, runny nose, stuffy, crappy feeling, right? But it's all gonna be up here. The other 20%, the bad people, that's what affects your lungs. That's the bad stuff, right? So, what happens if you touch the coronavirus and you stick it in your mouth? What do you think is gonna happen then? You think you're gonna get it?
Yeah.
Well, probably might, right? So it's got to go from, it's a droplet, right? And to be order for it to be bad, it's got to go all the way in your lungs, all the way down here, right? So if you touch something and it's on your hands and you put it in your mouth, it's not easy for you to re-inhale it because it's going to be wet and it's going to be in your mouth and it might be just sitting here and you might swallow it into your belly. And what happens if it gets inside your belly?
It has babies.
Well, not yet. It doesn't have the babies yet. We're going to talk about that, right? But it maybe makes your stomach feel upset. Maybe you don't have an appetite, you can't eat, right? So that's where you have some stomach ailments, but it's less likely. That's why not too many people have stomach problems because your stomach has, what does it have inside your stomach to kill everything, right? It's got different chemicals to break down food, right? So that's why your stomach is pretty good about breaking down bad stuff. Yes?
If the coronavirus on the cold flu, do we vacuum it?
Can you vacuum the coronavirus? That's a pretty good question. I'm sure you could vacuum it up, but the filter and the vacuum is not thin enough. The microns aren't thin enough, so you're going to vacuum it into the vacuum, and it's going to spit it right out past that filter because it's about a 3 or 5 micron size filter is what you need to stop it, right? But our air freshener, we have the ionization, will kill it, right? Because that's got UV light, and it's got all the ionizations to kill that, right? We'll talk about that later. So, oh, thank you. Okay, so what about if you get it in your eyes? If you touch your eyes,
Your eyes will hurt.
yeah, your eyes hurt, and it's going to act like it's an upper respiratory. So you're going to get the sinuses again, maybe, right? But less likely. But it's still going to be upper respiratory, right? So,
Are you gonna get a fever?
you'll get a fever, exactly. And we're going to talk about why you get a fever too, okay? So we talked about if you inhale it a little bit, it starts up in your head. If you inhale it a lot, it gets in your lungs. Big problem. That's why it's important we wear the masks because the number one way it hurts you is through inhalation, right? It's respiratory. Okay, so who is the people that are most likely to get sick from this?
The grandmas and grandpas.
Grandmas and grandpas, the people who that smoke, the people that are obese and are that weigh too much, right? Because they're not in good shape, right? The people that have other conditions like COPD, emphysema, sleep apnea, asthma, hypertension, right? Those people, right? So how do you, in order for this to be strong, you have to eat good, you have to be in good shape, you have to be healthy, and right? And we can't do anything bad. We have to be really strong, and that way we can beat up this stupid coronavirus, right?
Daddy and Papu.
Okay, so this is our virus. So it gets from the mouth, you inhale it, down the trachea, into the lungs, right? And now what happens is, where's my next picture? Here, ready? So what happens is, this, right, we're gonna talk about this. What is that?
This is your lungs.
This is your lung. Okay, so let's squeeze it, right? And we just took a breath out, right? Now take a breath in. The lung gets big, right? Take a breath. Now exhale. Inhale. The lungs get big, okay? What are those little air pockets called? Alveoli. That's where the oxygen happens, okay? Yeah, that's a different one. We're going to talk about that one next, okay?
No, I want to pop the button.
So, the air pocket, right, is where all of the air exchange, you get your carbon dioxide and your oxygen exchange happens in those small little holes. Okay, that's where you get your oxygen from. Go sit down, sit in class, let's go. Okay? So, there's two types in your lungs, there's two types of lung cells. Okay? You have type 1 pneumocytes, which is your gas exchange, right? And this is the type 2 pneumocytes, which creates a surfactant. And what's a surfactant do? Remember?
It does.
Yeah, the surfactant is the oil that allows the lungs to go open and close, open and close. If you didn't have that oil, the lungs are going to get stuck. It's like rusted. So that's why you need the surfactant to allow the lungs to open and close. That's the type 2.
What's surfactant?
Surfactant is like the oil that lets them be spongy, right? It's like an oil, so it's nice and soft. So
What happens if they don't have
well, that's what we're going to talk about because that's what coronavirus does. It attacks the type 2 pneumocytes, which produce surfactant. And here's how that happens. Ready? Okay, so a virus gets into your lungs, okay? And it attacks the type 2. So watch what it does. Okay, there's your type 2 pneumocyte, right? Which creates a surfactant, which allows your lungs to be able to expand and contract. So watch, James, stop. So this is the coronavirus, right? It's a single-stranded RNA, and it's got all these octopus tentacles. Good. And see how this is the same color, right? That's called ACE, angiotensin converting enzyme, right? ACE. You see the people that have high blood pressure that are not healthy, they are on the drug that has an ACE inhibitor, right? Which is why people with high blood pressure have problems with coronavirus. That's why you have to keep your blood pressure in check. Okay, so look at this. So this enzyme is like a flower. It smells really, really good. And the coronavirus smells it. It's in your nose. And it's like, I smell it. Where is it? Let's find it. And it goes all the way down.
Does the coronavirus have a nose?
It smells the enzymes. Yeah, it's almost like a little nose. And then it goes down here. And then it goes and it finds the ACE enzyme. Okay? And watch what it does. It takes his little tentacles and it and it sticks them in there.
And it sees those little holes.
Stop, James.
He goes in the little holes.
Yep. So it sticks inside the enzymes. And then what does it do? It goes inside its body, in the cell's body. It goes inside it.
And then he has babies.
And then, oh, look at the little corona babies. Are they cute?
Yeah.
No, they're not. Those things are going to kill you. We don't want those damn babies. These are the bad babies. Okay, so the coronavirus goes in and starts having little babies. And then it leaves. And now another one is made. And it gets another one. And it makes more babies and more babies and more babies. But what happens to this guy? What happens to the type 2 pneumocyte? It dies. Coronavirus just killed this poor little guy. Look at him, see? See this little guy? We need this. This is where the oxygen happens, right? It's like kind of like your alveoli. It's like a big bubble. It's an air balloon. But what happens? Now it's dead.
How is it?
And look at it, because the coronavirus got inside and it killed it. Okay?
It kind of looks like a finger.
Well, yeah, because it's like a balloon that popped. This is what it should look like, a big balloon. It's an alveoli. It's like a big balloon, open and close. It gets all the oxygen, but it gets in there and it dies, right? So that's not good. It killed it. Think coronavirus. Hang on, guys. All right, so.
Can you crawl on my back now?
Yeah, we will after we're done. We're almost done. Okay, so let's focus here, guys. This is where it gets good. This is what's going to happen now. So what happens? The cell, the type 2 pneumocyte dies. Look at it. It's dead. Pay attention, right? And it causes let's see it. Oh my God. You have a coronavirus. Are you serious? You got corona? Oh my God. You're gonna die. It's in your belly. You gonna die?
No.
Okay. So we're gonna draw this on your whole body. We're gonna make your lungs and we're gonna draw it. All right, so what happens? The cell dies and it causes, your body says, oh my God, what's going on? Something's dying inside me, and it causes an inflammatory response, right? That's your body trying to fix itself, right? So what does it do if you have like a swollen finger? You get, your blood goes there, it gets swollen, you start to build up, like look at this, like a little scab. That's my body trying to fix it. It's my arm, it's all scratched up, right? Yeah, my scar, see? All the stuff to fix the scars. That's my body sending little soldiers there to fix it. But these little soldiers cause the problem. They're trying to help, but they don't know. Oh my gosh.
Do they die?
Well, they're kind of making things even worse. They're producing, the inflammatory response produces interleukin 1, interleukin 6, right? And tumor necrosis factor alpha. This is your inflammation process, right? And that's your body trying to fix itself. So that's good, but your body's so confused with what's going on that it's kind of overdoing it. It's sending too many soldiers there to fix everything, right? So that's where the problem lies, right? Okay, so here's what we got going on. Now pick up the sponge. Right? No, your sponge there. Hold it like this, right? Hold it right there. Just like this, okay? So watch.
I'll stand.
That's what a normal lung would look like. And this,
It's the brain.
well, no, it's not the brain. This is your lung because Corona started to eat it and it's starting to die. It's eating it all. So all those inflammatory response,
It's getting on your paper.
it's getting everywhere. Just watch. So watch this. So grab your sponge, lay it down. Okay,
Can I
watch.
mix them
So
up?
watch. All that stuff is gonna go. And hold on, watch. What is all this? Let it go. This is your body's cells dying. That's an interleukin, right? That's all the different stuff. So watch what happens. So after that dies,
Stop.
you have vasodilation, and that's all the plasma spilling out from the interstitial space into the lungs. And then your fluid in the alveoli is spilling out, right? It washes out all the surfactants, and now the balloon doesn't work, right? It can't go open and close, open and close.
It's spilling.
It's spilling out. Look at that. That's exactly what your lungs are looking like, right? Leave it alone. Okay. So what is this called? So it starts, let's just say it starts up high in the lungs. Now stop, watch. Let's see what it does. What's it doing? It's going down.
It's going down.
Why is that? That's called consolidation because gravity is making all the water in your lungs go to the bottom, right? So look at this. So in our picture here, everything starts to go down and you get, what is that called? Pneumonia. That is what pneumonia is called. But when it's all said and done, it's going to be all at the bottom and it's going to be sitting all down there like a pool of water. Water doesn't go high, it goes all the way down. And that's called consolidation and it's pneumonia. Right? All those alveoli. Okay? So, all that pneumonia is causing now your lung can't open and close. Look. It can't even open and close. It's so stiff and it's so hard that it's not working.
On my feel.
That's right. It won't open and close. The pneumonia is full of, and now you can't get any air inside your lung, right?
Well,
So-
down here.
Now there's no gas exchange, right? So what's going to happen? You're going to try to breathe harder. So, hey, James, show me how you breathe hard. Harder. You can't breathe. Hard. Oh, there it is. Labored breathing, right? So good, because that's exactly what happens, right? Because you can't breathe, right? No gas exchange. You get hypoxic, which causes increased CO2, which causes labored breathing, which causes, what is this? What's mechanical irritation? What does this go? Ha, choo, and you spit out, ha-choo. You just sneeze and you just coughed. And now you can spread the virus even more. That's called mechanical irritation. Okay? So, okay, don't throw it all the way around. Stop. Okay, hold on a second. Hold on. Okay, stop. No more throwing. Leave the lungs alone. Stop. Leave my lungs alone. Everyone stop now. Okay, sit down. Pay back attention. Sit down. Okay, so now you have mechanical irritation. You start to cough. You start to sneeze, right? Your interleukin 1 and interleukin 6. Leave it alone. What does it do? What does the interleukin do? It signals the hypothalamus to release what? Prostaglandin, right? What does that do? It causes you get it hot. It gives you a fever. I mean, you got pneumonia on your nose, dude. Okay? Oh my God, you got pneumonia in your belly button?
I have coronavirus.
You got the coronavirus. Okay, so you get, all right, your prostaglandin produces fever,
Cold.
right? And then you get hypoxic, right? Which triggers your chemoreceptors to stimulate your your sympathetic nervous system, right? Which causes increased heart rate and increased respiratory rate, right? And then what? Guys, this is bad news. So now we're going to have to go on the ventilator, right? The mask on your face to help you breathe.
Go like that.
Because you can't breathe. This is all in your lungs.
This is the mask.
It's kind of like that, right? So now this is the couple people that have the severe ARDS, acute respiratory distress syndrome. And that is not good. Got it, Coronas? Okay?
I have
So,
a mustache. Oh my
let's wrap this up.
I have a mustache.
So, you're an ARDS. Your body's breathing and breathing and breathing. Right? You're having a hard time?
Yeah.
What happens? Your body starts to compensate. Look like kids, guys. Listen up. Oh my gosh. Dude, you are a mess. Stop. It's all over your face. Okay, so then you can't breathe, and your body eventually cannot compensate. You tire out. Show me how you breathe again. In and out, in and out. And then you're getting tired, and you can't do it much longer. So then you stop breathing so much, and they have to put you on a ventilator, and your organs start to fail. You become septic, right? And all these bad things start to happen. Hey, stop. Stop it. Okay? So that way, this is where we get to the bridge. Look at this. Is this guy happy?
No.
No, he's sad because he's sick. What about this guy? Is this guy dead?
No.
Yeah. Look. This guy is sick. And this guy,
It's dead.
he's DED, dead. Right? So that's the bridge. So if you go from sick, you have to go across the bridge. You have to go through pneumonia before you die. So that's the process of corona. Not if you're strong, you're healthy, and you make sure you eat good, and you'll be strong, and you can beat up this corona. And we wash our hands, and
I already have corona on me.
yeah, dude, you're a mess. And that is a wrap.